I'm very glad to be with Mina today. She's the CEO and co-founder of AmplifyMD. Excited to hear more about AmplifyMD. What do you do, your solution, how you're making a difference. But let's start with introductions first. Tell us a little bit about yourself, your role, and maybe a short version of the story behind AmplifyMD.
Yeah, Sonia, thanks for having me. I'm really excited to be here today. Like you said, my name is Mina Malapeti, CEO and co-founder of AmplifyMD. We are an AI-enabled virtual care automation delivery platform with an integrated physician network of over 15 different E&M specialties. So we are the comprehensive solution and platform for hospitals, health systems, and really anyone looking for healthcare to get access to the care they need the way and where and when they need it. In terms of how and why we started the company, so we started actually before COVID. And while we are not clinicians ourselves, me and my co-founders, we talked to 498 doctors about why they used to love medicine and no longer do, or what's the
Or
most frustrating part of
98
it.
doctors.
498. I tracked it.
Wow. Okay.
Um, and doctors go into medicine because they want to help people, right? And the most frustrating thing for them is when they're not, whether it's because of they're spending too much time on paperwork, too much time on administrative burden, tech burden, whatever you want to call it, or they just can't get the care access to the care they need for their patients, and they end up having to transfer a patient they thought they could have helped, or something negative happens to the patient. They decompensate, they get a complication they probably didn't need to have. The patient had to wait months and they hear back from it and it's just negative feedback. So all of those things are driven by one key underlying problem for our country, which is there just aren't enough doctors to go around. In particular specialists, but also primary care, as we're hearing more and more every day, pediatricians, et cetera.
It's only
The
going to get worse, right? The
It's only
shortage.
going to get worse, about 200,000 physicians short by 2030, which is unfortunately only 5 years away.
Yeah.
And so we built AmplifyMD to be that care delivery network and underlying powering platform. So what we do with the platform is we drive efficiencies and provider workflows. So doctors practicing on our platform, whether they're our physicians or the health system's physicians, practice 2 times more efficiently. That means they can see twice as many patients in the same amount of time. So a typical doctor will, see patients for 4 to 6 hours a day and spend another 4 to 6 hours a day potentially on documentation and everything else that's non-patient related. We take all of that away. And what that means with that extra capacity is they can either see more patients, bring in more revenue, et cetera, or actually get a life and get some work-life balance, not burn out. Both of those are very important goals. Obviously, people make different choices for different reasons. But at the end of the day, that's why hospitals, health systems come to us, because we can help them make their own providers more efficient, drive their own internal provider capacity, provider utilization, solve those problems for their physicians and help them operate more efficiently. And we can also, at the same time, help them bring more access to care. With our integrated physician network, they can use their neurologist or our neurologist, or they can use their neurologist and our psychiatry team, because as we know, that's a huge shortage in psychiatry as well. So it gives them a ton of flexibility to both improve their current operational efficiency and lift their current team up to a higher level, but also to augment their team in a consistent, scalable fashion where they're not scrambling to recruit this doctor here and that doctor there. They know we've got the solution for them.
Yeah, so you started talking about the problems, the bigger problem of supply uh,
Mhm.
and workforce shortages that everybody's facing. And you were saying, let's optimize the capacity of the existing workforce that we have and help them
Yeah,
deliver care.
exactly. Great catch. So for us, I mean, the problem is there. It's not going away. It's not like we're
Yeah.
magically supporting hundreds of thousands of doctors. So the only way to really solve that problem is to do more with less. And that means making each provider you have today more efficient, which, net at the end of the day means seeing more patients in
Yeah.
that same amount of time without burning them out. And the only way you can do that is with ways that capture workflow optimization for the provider. So that's what we've done with our platform. So AmplifyMD through our AI and automations really streamlines the entire workflow. Old school telehealth, old school virtual care, it's a glorified Zoom connection like what you and I are having that absolutely does not cut it for doctors and for clinical providers,
Yeah. It's
right?
like FaceTime, a Zoom. Yeah. But
Yes,
that's
exactly.
not enough. Okay.
That's absolutely not enough. A DoxyMe, what have you. You need to have the whole workflow and you need to optimize the whole workflow. So that means scheduling, care
Mm,
coordination, pre-charting, helping them weed through the potentially sometimes thousands of pages of EMR notes, curated patient dossiers based on the reason for consult to
mm,
help with clinical decision making. Obviously the video visit, but that's so commoditized these days. I
yeah.
barely mention it. And then onto documentation to the point where by the time you're done talking to the patient, we can make sure that 80 to 90% of that note is pre-filled. That's power, that's optimization. And then all the way through to pushing automatically into your billing workflows. And then underlying all of that is an entire data schema and analytics that's tracking everything to optimize for best practices, continuous improvement. We can talk about what is a provider response time, how many, patients is this provider seeing versus that provider, where are the bottlenecks? Is it the response? Is it calling the consult? We can literally tell you, hey, patients are spending too much time in the ET. Hey, your on-site teams are taking too long to call the console. That's adding an extra 2 days to your length of stay. We could have cut that, right? Like there's
Mhm.
all of these different insights that we can draw because we are capturing both the performance and the data behind it.
That's so interesting. So it is that full workflow optimization and the analytics that help you really capture where those issues are. So um, tell me about specialties, because I know what I see is it's not just primary care or not just limited, but you're doing this across specialties. So tell us how that is unique and what you've learned doing that.
Yeah, absolutely. So in terms of specialties, we started, like I said, before COVID, and fortunately or unfortunately for us, we started with infectious disease and pulmonary critical care. So, talk about drinking from a fire hose.
So that was not intentional. You
That
just
was
started.
absolutely not
Wow.
intentional. Just happened to be kind of where our strength was and where we started. But we provide, like I said earlier, 15 different clinical specialty lines, E&M specialties, obviously all non-interventional. The most common ones requested, kind of day in, day out, bread and butter, are infectious disease, neurology, including stroke and acute teleneurology, psychiatry, cardiology, hematology, oncology, and then fast follow with palliative care, pulmonary critical care, and nephrology. So that's on the inpatient setting. One thing I do want to call out is we, as I said before, we're a comprehensive solution. We are completely hardware agnostic. We can work with whatever you have. So, ROI positive right there. So these expensive carts legacy systems have. We are completely clinical site agnostic. One of the unique things about our solution is we're fully bidirectionally integrated into your EMR. And so what that means
An
is
important point. Yeah.
yeah, very, very key. And this is part of some of the ways we drive those efficiencies for the providers is they don't have to log in and out. On-site care teams stay in their EMR, remote providers stay in ours, or we can integrate it either way. All the documentation ends up in the client's EMR at the end of the day. So everything is right there, labs, orders, notes, all of that, without people having to have the pain of learning a whole new system every single time they're supporting. But going back to what that means from a system perspective, we hardware agnostic, but EMR agnostic. We can integrate with any of them. We have over 98% market coverage. So Epic, Cerner, Athena, all of the guys, inpatient or outpatient. And then we are complete clinical site agnostic. And I'm bringing this up for a particular reason. We see patients all the way from the ED to the inpatient to the outpatient to direct to patient. So with
Oh,
that, yeah, across the entire, and that's why the integrations are so powerful. You do it once, it's one integration, one implementation, one training, and you're done. So from a maintenance, IT, change management, support, all of those cost perspective, it takes out all of that off their plate, and we replace between 5 and 7 different point solutions. Now a system no longer has to look for a telestroke vendor in the ED and a separate telepsych vendor for the ED, and then someone else maybe to do ID or palliative care inpatient, someone else to do neuro outpatient. Like all of that is there in one umbrella, one simple to use system. And again, once you're installed, we become the easy button, right? So when systems come to us, they come to us for one of two reasons. One, they want just the platform to drive those operational efficiencies for their own providers. Or two, they come to us for clinical services help, right? Where they have certain specialties, but not others, and they want to add to their resources to make sure they're not transferring patients or having, unnecessary long lengths of stay or, inappropriate coverage. So we're helping them on both fronts, and that's where the specialties come in. I mentioned the ones from earlier, from neuro to ID to psych and all of that. Those are typically inpatient and outpatients. We do the virtual outpatient clinics. On the pure outpatient side, we also get a lot of requests for dermatology, endocrinology, and rheumatology. So
that's super helpful. And thank you for sharing the gamut of services and specialties that you cover. So is there, from a truly tactical interface, so is there is this primarily for physicians, or is it also for administrative staff to see some of the workflow pieces? How does that work?
oh, that's a great question. We've actually never been asked that before, but we do have that. So we actually have a fully functioning, robust administrative panel, administrative portal. for leadership or for stroke directors or for the ED, anyone who wants to go in that is authorized to, based on, how we set it up at the implementation, can go in, pull the data, look at their dashboards. We have automated dashboards. We have customizable dashboards based on what's important to them and their programs and their KPIs. And they can also, go in there and look at different schedules and look at how, different provider performances and wait, what are the takeaways from this? So all of that is available at the click of a button, and all of that is customized and configured at the implementation standpoint. And when I say implementation, I know a lot of your health system clients are used to months and months, 6 months, 12 months. I don't know, with the EMR, some,
Yeah.
longer. We literally can be up and running in 2 weeks. We are, within our side, we're ready to go kind of almost immediately from contract signing. Obviously, there's security reviews and things on their end they need to do. But with the way that we work and the way that we're configured, the rate limiting step is going to be on the hospital and health system side, not on ours. We use Fire APIs, make it really simple, and make sure that as they're getting access to a system and a platform and a solution they want, it's set up not just the way they want, but quickly, so they can actually get that usage as near time as they can.
That's great, because I think the implementation, there's so much fatigue around that, of like long drawn out implementations and all the work that goes into that. So it's refreshing to hear that this is a much simpler way to go about it. Tell
Yeah.
us a little bit about KPIs, metrics. What results are you seeing?
Yeah, no, that's a fantastic question. In terms of KPIs and metrics, from the clinical services perspective, we have dramatic results across the board, regardless of specialty. We're cutting transfer rates 80-85%. We're cutting length of stay. About 70% of our patients are discharged below mean length of stay. We're cutting readmission rates 30-40%. We have really high patient satisfaction scores and peer provider satisfaction scores, 9s out of 10s and 90s out of 100s, depending on how you measure it. So we're very proud of our numbers and our metrics and what we're doing. We're helping hospitals, health systems, providers, patients stay local, stay home, stay in their community, right? And that also means keeping the dollars in the community. And quite frankly, healthcare is a business. We have to take that into account. And the more you can do locally and not lose that patient, lose that transfer, lose those imaging, all of those, the more robust you're going to make your local communities and your local health systems. So that's on the clinical services side. On the platform side, like I mentioned earlier, we make our providers 2 times more efficient. And when I say our providers, again, that's anyone on the platform, whether it's a health system physician or ours internally through AmplifyMD. We're cutting, we have the country's leading stroke response rate. So if you're looking at our telestroke program, we're responding to strokes within 38 seconds. We're cutting 12 to 15 minutes off of the entire process, and time is brain. So that's significant for whoever that patient is getting treated. We are finishing the entire consult within 40 minutes, including the note in the EMR, with below average door to needle times. When I say below average, I mean in a good way. We're the fastest in the industry. So in that kind of mid to high 40s range. So all of those decision points are key for a program like telestroke, which we know is kind of critical for a lot of hospitals and health systems that don't have 24/7 neuro coverage or interventional coverage, et cetera. So I bring that up because that's a common and easy use case to talk about. For psychiatry, right? We're able to, because of our platform, we're able to see and discharge these patients, over 85% of the patients within the same day, within hours, because we're able to see them, treat them, stabilize them, do whatever we need to do to release the hold, put in prescriptions, etc., and then get them out to home or a lower level of care. So they're not sitting there clogging up the ED or boarding in the ED, waiting to be seen for psych, which is, unfortunately what happens to many of these patients. And we have programs where we're working with systems that multi-state, multi-EMR. And because that we're completely EMR agnostic, we can actually connect, even whether it's within your system, to an affiliate network. Perhaps you're trying to build up your own virtual care network with your excess capacity now that you've got our platform. We're completely agnostic on the EMR. So that means that your doctors can still work in your EMR, but treat patients across any EMR, any other system. So that really impacts the power of and the ability of a system to build out their own resources, their own network, and kind of let us help amplify your MDs across the board.
Oh, I love how you tied it into the AmplifyMD. That's good.
Easy, but I have together.
No, that makes a lot of sense. There's a lot of systems we see struggle with that issue of having those affiliate networks and others where you don't have the same EMR, and how do you stay just efficient in managing across that? So the less tied in you are to, this is almost like a layer that lives above the
Yeah.
EMR that allows you to go smoothly across all those different factors. So that's great.
I mean, one little
All the examples you shared were
Yeah.
super.
One extra tidbit there, just to give you an example of how powerful the platform is across different areas. Stroke, for example, you're supporting multiple hospitals across the entire country. You know, we're talking up to 100 hospitals at a time on one panel. We can see patients, like, again, that 38 seconds response time is regardless of which EMR, regardless of which hospital, regardless of geography.
Yeah.
So just the power of the platform in terms of delivering care and access to that care.
That's impressive. It sounds like this is exactly what most health systems need right now. I'm going to ask you, what has been some of the boulders or challenges as you see health systems wanting to adopt this, but maybe can't move as fast, or can they? What has been your experience in just getting health systems, service lines, physician staff to
Yeah.
on board? And how do you,
Honestly,
what do you
it's
say you would do to overcome it?
Yeah, no, exactly. I would say the biggest challenge for us to overcome is PTSD, right? Because they have
Oh,
all had
interesting.
some level of experience with the
Mm.
old school telehealth. And
And
again,
that
old school
didn't go
telehealth,
well. Yeah.
yeah, it didn't go well. It was a glorified Zoom connection. It came with expensive carts that you had to buy, and they just
Mhm.
have a lot of trauma around that. It didn't solve their problems. The providers got frustrated. It wasn't high quality of care. So they've just had a lot of bad experiences. So then I come along and I say, "Hey, I can solve all your problems for you." They're like, "Nah, I don't believe you."
Yeah. Yeah.
So it's just, and at that point, we now have a number of marquee clients that are attesting to the great work we're doing. We have a number of nationwide medical groups that are on our practice, again, attesting to the great work we're doing and how we're improving their day-to-day practices, their day-to-day care of their patients, helping bring in new revenue from patients they couldn't reach before, helping reduce costs and increase margins because they're more efficient and more cost effective and treating patients in a more streamlined manner. All of these real dollar hard facts, positive ROI stories are really critical to changing the minds and showing them, hey, actually, we are different, right? So that's why I don't even use the word telehealth. I use virtual care
Yeah.
to combine, again, capturing that entire clinical workflow. That's the only way you're going to make the difference. I think people are starting to see that, right? They understand that the hardware is not the important thing. The
Right.
video
It's
connection.
not about the video. Yeah.
Exactly. It's everything else. It's virtual care is care. And as people look to deliver care in more innovative models, they realize that they have to have some version of integrated virtual care with their system. And
Yeah.
as they explore us and learn more about us, like, hey, this is actually a great way for us to do it because we could do it with our doctors or your doctors, and we give them all the flexibility to meet them where they are.
Yeah. No, that makes a lot of sense. And I can imagine it's been a uphill challenge for some, where I think many physicians in general have been burnt by the promise of technology that didn't pan out, whether that's virtual care or the EMR or anything else. So I think showing how this is different and the value of it is key. Um, any last words and things you'd like to share about AmplifyMD that is coming up, or anything else that we missed that you'd like to share before we close our time?
No, I mean, I'm looking forward to hopefully hearing people's feedbacks as they listen to the podcast. But more importantly, if you're there at any upcoming conferences, we'll be at the International Stroke Conference next week in LA. We'll be at Vive in Nashville in a couple weeks after that. We'll be speaking at ATA Nexus and the various hospital associations. We've got some great case studies out there, so come engage with us and see what we can do for you.
That's fantastic. And as a reminder, you can also come to AVIA Marketplace to learn more about AmplifyMD or reach out to Mina directly here. Mina, thanks again for your time. This has been great.
Yeah, thanks so much, Sonia. Have a great rest of your day.